straight. Going ahead with the talk. Greetings to Gynecology 2025 London, UK. Scientifically stimulating, enriching global platform today. I'm Dr. Saumya Pandey, PhD Life Science, having worked as Head Clinical Research Indira IVF Hospital, Udaipur, Lucknow, India, and I present today in the session Reproductive Endocrinology and Infertility with the title Inflammatory Microbiota Associated Maternal-Fetal Receptors as Promising Immunotherapeutic Targets in Mycobacterium, tuberculi, and human papillomavirus positive infertile women of North Indian ethnicity. Public health impact. May I request the expert assistance for the slide transition? Next slide, please. Thank you. Objectives. Infertility is a global public health problem. Cost-effective, patient-friendly treatment modalities along with psychosexual intervention strategies are indeed essential for tobacco-mediated infertility control prevention management among ethnically disparate populations globally. I aimed to identify cellular, molecular, genetic, molecular regulatory networks, crosstalks in inflammatory microbiota-associated maternal-fetal complex labyrinth for developing innovative toll-like receptors, TLRs, and progesterone receptors-based immunotherapeutic targets in MTB and HPV-positive infertile women of North Indian ethnicity in a prospective single-center hospital-based clinical research study enrolling North Indian infertility patients from Lucknow, UP, India. Next slide, please. Materials and methods. The prospective single-center hospital-based clinical research study was conducted at the study site Indira IVF Hospital, Lucknow, Uttar Pradesh, India, between April to September 2020. The sample size was 910 infertility patients of North Indian ethnicity with the inclusion criteria age more than 35 years, North Indian ethnicity married more than 1 year, endometrial thickness more than 6 mm. Exclusion criteria included prior more than 2 IVF failures, fibroids, adenomyosis, cervical cancer, thin endometrium, endometriosis. Biochemical immunodiagnostic assays were Mycobacterium tuberculi positivity assessment using the high-throughput gene-expert TB Gold PCR testing with high sensitivity and specificity, endometrial thickness using color Doppler imaging modality. HPV positivity was evaluated using Food and Drug Administration USA-approved hybrid capture HC2 genotyping assay. IVF success was determined by evaluating average oocyte yield per donor, oocyte quality, M2 oocytes, total frozen embryos transferred per month, the pregnancy, beta human chorionic gonadotropin HCG positivity, and tobacco usage was ascertained using bilingual questionnaire, English and Hindi dialects. Written informed consent was taken from participants, and the study was approved by the local institutional review board. Next transition, please. Next slide. Now, the clinical intervention and planning for ovulation induction in IVF in infertile women was assigned using biochemical tests, procedure, hormonal assessments for AMH, serum prolactin, LH, estrogen, FSH. Titers cutoffs were evaluated as per the standard reference ranges. Endometrial thickness was assessed using color Doppler imaging modality, MTV positivity by gene-expert PCR-based technology, and psychosexual intervention incorporated marital relation counseling, sessions therapy, referrals for psychiatric assessments, cognitive impairments, schizophrenia, depression. Recombinant FSH started at a dose of 300 IU or a combination therapy in an antagonist protocol on day 2, and antagonist 0.25 mg started when the lead follicle size was 12 mm. Human chorionic gonadotropin trigger 250 microgram was administered when major cohort of follicles was 16 to 19 mm in size, and embryo freezing was done on day 3 to 5 using vitrification. Subsequent freeze-thaw embryo transfer cycles were performed with subsequent hormone replacement cycles. Embryo and oocyte quality assessments were carefully assessed and sterilized. Contamination-free laboratory culture conditions. Environment was strictly maintained during the entire transfer procedure for ensuring high sensitivity and overall IVF regimen so as to avoid any technical errors and potential failures at critical steps such as oocyte retrieval, embryo transfer, and so on. Clinically relevant determinants of IVF success rates among infertile women residing in Lucknow, Uttar Pradesh, India included successful frozen embryo transfers, quality of oocytes, oocytes retrieval, M2 oocytes yield, implantation rate, biochemical pregnancy, beta HCG positivity, and ultrasound-based pregnancy confirmation with live birth per IVF for assisted reproductive technology procedures and safety assessments with live birth rates and safety assessments including adverse drug reactions, either local or systemic, and ovarian hyperstimulation syndrome. And this protocol has been published by me in the SAGE publication Psychosexual Health, focusing on the psychosexual aspects of infertility in women of Indian ethnicity. May I request the next slide, please? Results: mean age and intermetrial thickness of study participants were 34.1 years, standard deviation 0.8 and 9.1 mm, standard deviation 0.2 respectively. Average body mass index, BMI, and AMH levels were 25.0 kg per meter square and 2.2 nanogram per ml. Embryos transferred per month were 123 for April, 165 for May, 183 for June, 159 for July, 139 for August, 141 for September, and pregnancies beta HCG positivity 96, 134, 145, 120, 106, 113 for months of April, May, June, July, August, September 202, thereby yielding successful IVF trends. Subgroup stratification demonstrated M2 versus total oocytes retrieved 70%, 68%, 71%, 72%, 77%, 67%, and the overall IVF success rates were 78% for April, 81% for May, 80% for June, 75% for July, 76% for August, 82% for September, while the frozen embryo transfer success was 72%, 78%, 70%, 69%, 63%, and 77%, thereby highlighting the evidence-based successful IVF success trends amongst my North Indian study cohort residing in Lucknow, Uttar Pradesh, India. Next slide, please. MTB 55.6% and HPV positivity 12.0% and self-reported tobacco usage. Environmental tobacco, either active or passive, or smoking or chewing, has been implicated as a predictor of MTB or HPV-mediated positivity amongst women of childbearing age, including infertility. These were significantly associated with aberrant fetal cardiac activity, higher trends of intrauterine growth restriction, and stillbirths P less than 0.05. English Hindi-speaking infertile women's self-reported treatment-related satisfaction rates of 80 to 100%, which was indeed a good indicator of the study strengths. My exploratory innovative reproductive endocrinology fertility science study provides fascinating avenues for development of cost-effective toll-like receptors, progesterone-based predictive biomarkers in stratifying MTB and HPV positive infertile patient population cohorts of varying genetic landscapes and identifying aberrant microbiome at the maternal-fetal interface, tilting the embryonic fetal fate towards stillbirths and or autophagy-mediated cell death. May I request the next slide? Clinically relevant burning questions that demand immediate attention of the scientific clinical research community worldwide: oocyte maturational competence and integrity, sperm function, quality, pre-embryo culture conditions, pre-embryo morphology, and ovarian age are emerging as significant physiological immunobiological factors for determining a successful implantation and a pregnancy outcome in a specific subset of infertile women of ethnically disparate populations, including the study cohort of North Indian women residing in Lucknow, UP, India, as well as warranting future multicentric studies with pharmacogenetics or causal association, prospective, large sample size-based, evidence-based gynecology and obstetrics, reproductive medicine, clinical research on a global platform. Receptors and inhibitors in cell signaling, biochemical signaling pathways may be the eventual cost-effective predictive and prognostic biomarkers in infertility management in the coming years in the near future, so as to reduce the increasing psychosocial and financial distress associated with infertility treatment amongst infertile women, couples of differential socioeconomic status, either UK pound sterling, US dollars, Indian rupees, at reproductive medicine laboratories, medical centers stringently managed by a highly qualified scientific expert in the reproductive medicine healthcare arena. So a lot of thrust on receptors and inhibitors and cell signaling, biochemical signaling pathways for predictive and prognostic biomarker development. Next slide, please. Physiological reviews on infertility highlight that the offspring level may be predisposed. At the population level, we may find infertility with sexual dissemination of diseases, viral reservoir persistence, viral integration in the germline and offspring genome with the endogenization. And at the individual level, there may be endocrine perturbances, tilt in the hormones, primarily anti-Mullerian hormone, follicle-stimulating hormone, luteinizing hormone, the FSH, LH titers, and the AMH levels, endocrine disturbances, and these may predispose and future, they may be transmissible to the embryo development abnormalities and viral chronicity at the offspring level. So a lot of studies going at the population level as well as the individual level, warranting causal association studies, prospective, observational, multicentric studies for predictive biomarker development in infertility management globally. Next. There is a lot of thrust on receptors, primarily the toll-like receptors, in clinical research in gynecology, obstetrics, and reproductive medicine infertility. And this is my first scientific publication by Saumya Pandey in Immunology and Cell Biology on August 6, 2006, published from United States of America, focusing on toll-like receptors, a family of evolutionary conserved pathogen recognition receptors playing pivotal role as primary sensors of invading pathogens, with TLRs that identify molecular motifs of infectious agents, pathogen-associated molecular patterns, eliciting an effective defensive response against them. And mammalian TLRs derive their name from the Drosophila toll protein, with which they share sequence similarity. And TLRs are an array of TLR1 to TLR10, and they have the MyD88 and the TRIF-mediated signaling cascades, leading to inflammatory, interferon, regulatory factor, upregulation, and cytokines and chemokines upregulation, predisposing the asymptomatic MTB or HPV positive cohort of women towards the symptomatic full-blown HPV or MTB mediated infertile symptomatic patient pool. So there is accumulating evidence that we may therapeutically, biochemically target the toll-like receptors, the toll-like receptor agonists, even the toll-like receptors inhibitors for identifying predictive and prognostic biomarkers for future cost-effective management of Mycobacterium tuberculi mediated infertility in susceptible cohorts of varying genetic landscapes. So this is one of my first publications in immunology and cell biology, published on August 6, 2006. So a lot of thrust on toll-like receptors in clinical research, reproductive medicine, gynecology, obstetrics for predictive and prognostic biomarker development, warranting future dynamic collaborations in the coming years. Next slide, please. As I already discussed, that TLRs are an array of TLRs 1 to 10 with different sets of ligands, and TLR1 have the triacyl lipopeptides, TLR2s have lipoproteins, PGNs, LTA, porins, lipopolysaccharide endotoxin, zymogens, trypanosomal phospholipids, HSPs, which are the heat shock proteins. Then we have the TLR3 and TLR4, which has the LPS endotoxin, TLR5, 6, 7, 8, 9, 10, and 11. So it's the array of toll-like receptors at the transmembrane level and different ligands, the pathogen-associated molecular patterns, a complex interplay between the receptor and ligand, subsequent downstream signaling cascades, the MyD88 and the TRIF-mediated pathway predisposing the host towards inflammatory mode with the upregulation of cytokines and chemokines. Next, the complexity of the TLR-mediated pathway, the MyD88 and the TRIF-mediated, all TLRs 1 to 10 work by this signaling mechanism. They identify the ligands at the transmembrane level. leading to the pro-inflammatory cytokines and chemokines induction, or the type 1 interferon induction. And specifically, toll-like receptor 3 works via the TRIF-mediated pathway, leading to caspase recruitment for apoptosis-related signaling, leading to cell death. Next. This is a publication in Frontiers in Cellular and Infection Microbiology, reviewed by me, Dr. Saumya Pandey, showing the complexity of the genomic organization and life cycle of human papillomavirus, the virus entry, multiplication at the different phases with the circular double-stranded DNA genome and the early genome, along with the L1 and L2 upstream regulatory regions, the abrasion providing HPV access to basal keratinocytes, the viral DNA integration, replication, relying on the host DNA replication machinery supported by the early viral proteins E1 and E2, and the viral genome replication in the infected basal and stem cells, establishing the human papillomavirus episome copies with split between the daughter progeny as the cells divide. So a lot of complex interplay and talk going at the transmembrane level in the inflammatory, altered, physiologically aberrant milieu of the host cell in MTB positive or HPV positive women of childbearing age. And the early viral proteins E6 and A7 stimulate the continued proliferation, and upon terminal cell differentiation in the upper epithelium, L1 and L2 become activated to package the high number of viral DNA copies with the E4 disintegration with the cytokeratin filaments, and the virus released as keratinocyte remnants are sloughed off at the epithelial surface. And this is where the therapeutic biochemical targeting of the complex array of toll-like receptors with TLRs 1 to 10 comes into the big picture to therapeutically target toll-like receptors mediated biochemical cell signaling for predictive and biomarker development with a complex interaction at the very viral entry and the subsequent inflammatory signaling progression, predisposing normal asymptomatic women of childbearing age with MTV positivity, Mycobacterium tuberculi positivity, or human papillomavirus positivity towards the symptomatic susceptible cohort. Next, we have the low-risk HPVs and the high-risk HPVs, which have the effects on basal epithelial level, as well as the HPV immune response and potential routes of entry with the inflammation, natural killer cells, influction of Langerhans cells, influction of CD4 positive T cells, disturbing the mucosal barrier integrity. And that's why at the complex labyrinth of the maternal-fetal interface, the mucosal barrier integrity gets perturbed with the HPV as well as the MTV positivity. And there is a lot of public health opportunity for targeting HPV as well as MTV immunobiology by the immunotherapeutic targeting of the complex array of toll-like receptors, interferon cyclooxygenase 2, tissue inhibitor of matrix metalloproteinases, and autophagy biochemical signal transduction cascades. Next. Psychosexual perspectives in infertility. In my expert opinion, we have few questions that demand immediate attention of the gynecology and obstetrics fraternity. How is infertility management different in terms of quality and cost effectiveness from public health perspective in India compared to the Western world? What is the future of infertility-related patient-centric clinical research in the years to come with the advent of high-throughput sophisticated diagnostic techniques, including color Doppler imaging modality? Infertility management has become relatively simple and safe, so certain technical artifacts may lead to possible misdiagnosis in certain cases. In this context, could missing an accurate diagnosis in the infertile Indian patient cohort mean a high price to pay? And could the patient be lost to follow-up? In my expert opinion, there should be a consensus regarding the patient counseling sessions organized at infertility clinics in India, primarily North India, or in the state of UP, even at the global level, across United Kingdom, Africa, Asia Pacific, as well as America up to different continents, so as to whether the infertile couples of varying genetic landscapes and lifestyles should be counseled together and subjected to gender-specific male and female-only individualized counseling. Next, please. The entire cost of infertility treatment is very high, so a state-specific nodal center for infertility patient is required by assessing the cost factor, eliminating the blame game among infertile couples. Is it the husband or the wife who is responsible for childlessness? Are there ethical dilemmas and constraints, including quality assurance and control in establishing, maintaining, and successfully managing an IVF lab in the 21st century? Moreover, how is the Indian scenario different from the Western or the British world with regard to the ethical issues and/or constraints, including informed consent? Now, compromising on embryo quality and culture media, including temperature variations, storage conditions, may eventually lead to ambiguous and/or contradictory IVF outcomes. So there should be stringent handling with qualified quality control and assurance scientific officer at the Infertility Clinic Medical Center. Micromanipulations and instrument-based experimental troubleshoots or artifacts in reproductive medicine research. So how can IVF clinical experts as well as infertility management be tackled to avoid erroneous and/or failed IVF results? Next, please. Conclusions aim to oocyte seal socio-demographics of infertile women and increasing age-aberrant AMH BMI profiles, endometrium receptivity, diminished ovarian reserve are promising predictors of IVF ICSI success in genetically distinct patient population subsets. My exploratory study warrants future multicentric gene epidemiology association public health studies with interventions for development of predictive biomarkers in infertility management post-COVID-19 Omicron pandemic vaccination era and identifying aberrant microbiome at maternal-fetal interface that may tilt the embryonic fetal fate towards stillbirth or death. Next. Moreover, IVF success rates, primary endpoints, clinical pregnancy, live birth rates remain relatively low, and primary because of implantation failure among infertile cohorts belonging to diverse ethnicities. This is published by me, Dr. Saumya Pandey, in Journal of Psychosexual Health in 2021, and with my scientific and clinical experience, expertise in biomedical research at premier medical centers in the United States of America, including Texas, New York, and Nebraska Midwest, and quality interactions with Asian Indian patients from Lucknow, UP, India, I strongly advocate the timely implementation of cost-effective, community-based tobacco cessation infertility management guidelines with robust public health research models in the specific population subsets of varying genetic landscapes and socioeconomic strata. Next, please. I speculate that oxidative stress caused by environmental carcinogen tobacco, either active or passive smoking or chewing, in the physiological milieu may be diminished by therapeutically targeting specific metabolic biochemical signaling pathways, primarily the enigmatic array of toll-like receptor pathways with toll-like receptors 1 to 10 that may be associated with cellular stress and/or death, immunomodulation and inflammation, and in this context, tobacco-mediated DNA damage, altered aberrant sperm morphology, motility, and diminished ovarian reserve endometrial receptivity in both male and female clinical infertility may be studied extensively by creating biorepositories or biobanks at designated medical centers globally, including Asia-Pacific region, as well as United Kingdom, Africa, Australia, Asia-Pacific, and United States of America. This has been published by me in Indian Fertility Society Fertility Science Research in 2017. Next, please. In my expert opinions, taught patient clinical specimens, namely blood, tissue, DNA, ribonucleic acid, sperms, embryos, and stem cells from biobanks may be strategically utilized for multicentric cohort-based pharmacogenetic genomic causal association epidemiological studies with statistically powered large sample-sized data sets for the eventual development of predictive biomarkers and therapeutic drugs for well-defined infertility patient population subsets, including the tobacco-using subgroups, of male and female patients with infertility and at-risk susceptible tobacco-consuming individuals at risk of developing infertility from random populations of varying genetic profiles and lifestyles. So this warrants today future globally evidence-based dynamic collaborations for the eventual design of predictive and prognostic markers in the ever-expanding complex field of gynecology, obstetrics, and reproductive medicine. Next slide, please. I have few publications, primarily in the Indian Fertility Society Fertility Science and Research. Tobacco as a significant predictor of infertility, a public health perspective in Indian scenario. Another in psychology and mental health care. Toll-like receptors, autophagy, Wnt, CRISPR-Cas, neuroimmunoinflammatory biochemical crosstalks, and artificial intelligence in embryonic induction and fertility management, translational health, biomedical life science research snapshot in American and Indian genetic landscapes, with another paper on psychosexual aspects of infertility published in Psychosexual Health, human chorionic gonadotropin HCG trigger-mediated ovulation induction in infertility management in South Indian women undergoing IVF ICSI regimens, which is the intracytoplasmic sperm injection, a pilot sexual medicine study with public health perspective. So a lot of public health impact-based, evidence-based, collaborative, large sample size-based global research is warranted for the eventual risk stratification of women with myriad gynecological ailments for eventual patient-friendly treatment modalities for risk stratification and subsequent biomarker development by adhering to bioethics and meaningful clinical practice. Next, please. This is one of my recent publications in 2024 in clinical research reports, Toll-like receptors and artificial intelligence in fertility management, clinical research snapshot in United States of America and Asia Pacific India genetic landscapes, and intriguingly, the evidence and emergence of AI in fertility medicine clinical research undoubtedly offers myriad immunopharmacological opportunities for demystifying the intricacies involved in tobacco-mediated infertility for achieving the quadruple objectives, improving the patient experience, enhancing productivity, along with efficacy in healthcare delivery, improving population health, transcribing prescriptions, treating patients remotely, virtually, and diminishing per-person healthcare expenses, as well as increasing the working conditions of healthcare professionals worldwide. So artificial intelligence algorithms amalgamated with evidence-based fertility management protocols are extensively used in healthcare, and in my expert opinion, there should be accuracy-based diagnostics, development of treatment protocols, medication research, and therapeutic customized tailor-made treatment regimens with AI fertility management protocols with clinical risk assessment, healthcare data privacy security, image quality analysis, digital health, AI-assisted robotic surgery, and health monitoring, active surveillance. So a lot of clinical research in gynecology, obstetrics, reproductive medicine with thrust on the enigmatic array of toll-like receptors and artificial intelligence in fertility management. And once again, this is one of my recent publications in clinical research and reports. Next slide. What will the audience learn from Dr. Saumya Pandey's Gynecology and Obstetrics 2025 London, UK presentation today? My promising reproductive medicine study emphasizes that M2 oocytes yield sociodemographics of infertile women and increasing age-aberrant anti-Mullerian hormone, BMI profiles, endometrial receptivity, diminished ovarian reserve are promising predictors of IVF ICSI success in genetically distinct patient population subsets. And with this exploratory innovative reproductive endocrinology fertility science study, with even the thrust on the enigmatic array of toll-like receptors and artificial intelligence in clinical research in gynecology, obstetrics, reproductive medicine, my study provides fascinating avenues for dynamic collaborations for eventual development of cost-effective toll-like receptors, progesterone receptors, predictive biomarkers, and artificial intelligence algorithms for stratifying Mycobacterium tuberculi and HPV-positive infertile patient populations of varying genetic landscapes and identifying aberrant microbiome at the complex maternal-fetal interface, which may tilt the embryonic fetal fate towards stillbirths and or autophagy-mediated cell death. Next slide, please. Dr. Pandey, that's me, acknowledges National Institutes of Health, Bethesda, Maryland, USA, for biomedical translational research experiences at Schools of Medicine, University of Texas Medical Branch, Galveston, Texas, USA, Creighton University School of Medicine, Biomedical Sciences, Omaha, Nebraska, USA, and New York Presbyterian Weill Cornell Medical College, Urology, New York, USA, and Merck Serono, India, Germany. And this is one of my first pictures. Dr. Saumya Pandey's first award at 4 years at Lamatinia Girls College, Lucknow, UP, India. So rising from the first award and thanking the scientifically enriching global platform today at the 3rd International Gynecology Obstetrics Conference with the SkyTech Conference Series expert team for providing me Dr. Saumya Pandey from my very first award at age 4 in Lamatinia Girls College, Lucknow, India, with all the achievements from University of Texas Medical Branch, Galveston, Texas, to Creighton University, Omaha, Nebraska, to New York Presbyterian Weill Cornell Medical College, New York, USA, and on a global platform. I thank the entire expert dynamic team of SkyTech Conference Series at this 3rd International Gynecology Obstetrics 2025 London, UK prestigious meeting for providing the platform to rise up to an international level for a meaningful, enriching, and scientifically stimulating experience in clinical research, gynecology, obstetrics, fertility, medicine, reproductive health research. Thank you.